And our last speaker is Lucia De-Pablo-Gómez-de-Liaño from Madrid, who will be speaking about comparing swept source and spectral domain OCT to look at the extraocular muscles.
Good afternoon. My name is Lucia De-Pablo, and I'm going to give you an overview of a comparison of swept source and spectral domain OCT to assess the insertion distance and thickness of extraocular rectus muscles. I'd like to start talking about how the OCT has emerged as an alternative for the assessment of the extraocular muscles in recent years. To date, some authors have focused on two parameters. The first parameter was the limbus insertion distance, which was measured by the pioneer Liu et al. In this and the following studies shown on this slide, good agreement was found between intraoperative measurements and OCT in the limbus insertion distance, even in eyes that have undergone previous surgery. Afterwards, good reproducibility of the limbus insertion distance measurements using OCT was observed. Most of the authors employed time domain OCT, which offers a low-resolution imaging that has been superseded by the spectral domain OCT, as you will notice comparing it with the image at the bottom, which was reported by our group. The second parameter studied was the muscle thickness, which has been interestingly measured in Graves' ophthalmopathy patients. However, there have been no studies to date using swept source OCT for the assessment of the extraocular muscles. Therefore, the aim of this study is to assess the agreement of the measurements of the horizontal rectus muscle insertion distance to the limbus and the muscle thickness between swept source and spectral domain OCT devices. In order to achieve this purpose, we conducted a prospective cross-sectional study on 70 eyes of 35 healthy hospital staff members. Subjects with corneal or conjunctival diseases that could make it difficult to define a clear limbus were excluded. The intraclass correlation coefficient and Blanalman plot were performed to analyze the agreement between the three OCT devices. The OCT employed were Spectralis, Cirrus, and Triton. The following table shows the main differences between the three devices, as well as the capture mode employed and the acquisition speed, which is faster with Triton. In the exploration protocol, the participants were asked to assume a lateral gaze, which allowed for exploration of the horizontal rectus muscles at 3 and 9 o'clock positions. With the three devices, the muscles were identified as hyperreflected structures between two hyperreflected bands, which corresponded to the sclera beneath the muscles and the tenon capsule and conjunctiva above the muscle. Over the images obtained, two parameters were measured: the insertion limbus distance and the muscle thickness, measured at 7.2 millimeters from the limbus for the medial rectus and at 8.5 millimeters for the lateral rectus. Please direct your attention to the measurements of the limbus insertion distance of these lateral rectus of the same patients using the three devices. And now focus your attention on the measurements of the muscle thickness of this medial rectus. And what about the results? We were able to measure the limbus insertion distance in all cases with the three devices. Meanwhile, the muscle thickness was measured in more than 94% of cases. The higher percentage of identification was with Triton. A subgroup of 20 eyes was randomly selected to assess the reproducibility. Higher reproducibility was observed for the insertion distance than for the muscle thickness measurements, and the highest reproducibility values were obtained with Triton. Regarding the lateral rectus distance to the limbus, the mean was about 6.5 millimeters with the three devices, and for the medial rectus, the mean distance was from 5.1 to 5.2 millimeters. There were no differences between the three devices in the mean distance. The results of the ICC and the Blanalman plot showed the best agreement between Spectralis and Triton devices. Regarding the lateral rectus thickness, the mean was about 200 microns. Meanwhile, for the medial rectus, the mean was from 164 to 170 microns. There were no differences between the three devices, and the best agreement was also shown between Spectralis and Triton. In our experience, we have found that Cirrus and mainly Triton offers a better visualization of the tendon and a larger exploration field than Spectralis. However, Cirrus and Triton have the main weakness is that this is only possible to perform one scan per exploration. On the contrary, with Spectralis, is it possible to explore the entire quadrant with 21 scans. The current study has several limitations. First, distances of muscles other than the horizontal rectus were not measured due to the worse quality of the image of the vertical muscles and the need of the eyelids manipulation. Regarding the exploration technique, it was difficult to measure at more than 11 millimeters from the limbus. To conclude, I'd like to summarize that ss-oct and spectral domain OCT are reliable and reproducible techniques for measuring the limbus insertion distance and the thickness of the horizontal rectus muscles. Excellent agreement was observed between the different devices for the limbus insertion distance, while the agreement for the muscle thickness was good. The best visualization of the muscle and the larger exploration field was obtained with Triton. Therefore, the OCT could be useful in the diagnosis of extraocular muscle-related diseases and in the preoperative evaluation with patients with strabismus, mainly in previously operated patients. Thank you for your attention.